Welcome to Amazing Mind, the HMI web TV talk show that introduces you to all sorts of interesting people and topics related to subconscious behavior. My name is Lisa Machenberg, hypnotherapist, HMI instructor, and host. Today we have an amazing guest. We have author Dr. David Newman. Now, David Newman is a doctor of psychology. He also is an honors grad of HMI College of Hypnotherapy, their distance education program. And he is an author of an amazing book called How to Find, Interview, and Select the Perfect Hypnotherapist. Please help me welcome my guest.
Thank you so much.
Well, David, I wanted to ask, why write a book about finding the perfect hypnotherapist? Shouldn't we just look in the yellow pages and whoever sounds competent on the phone, shouldn't we just book an appointment?
Well, unfortunately, that's the way that most people do it. But hypnotherapy is so specific, and we deal with so much, that you really need to find a person who's adequately trained, very professional, has the proper ethics. And so the book is designed to work from that standpoint. What questions should somebody ask as they interview for a hypnotherapist?
What questions should we ask?
First of all, do you have product liability insurance? What type of training do you have? How many hours do you do continuing education? How many clients do you see in a week? Is this full-time or part-time? Do you have any specialties?
But why do we have to be so vigilant?
Well, unfortunately, throughout the world, there's not any type of set standard regulation on anyone that wants to be a hypnotist or hypnotherapist. And you can go in and claim to be certified with as little as an hour's worth of training or no training at all. And unfortunately, these people are out there. So what I wanted to do was to give an insider's view to a person who says, yeah, I want to give hypnotherapy a try. I think this might help me. And what to do so that your experience is the best and you can find somebody extremely competent.
What's the minimum amount of education that you would recommend anyone who's seeing a hypnotherapist to make sure that hypnotherapist has? Between
300 and 700 hours of academic from an accredited school of hypnotherapy, and at least a year or a little bit longer of a clinical internship so that you can really hone your skills, because that's really what it is. This is not academic. This is really a combination of science and art.
You know, I open up the LA Times, I'm filming here in Los Angeles, and I see these big ads that say, stop smoking, $49, lose weight, $49, guaranteed.
Right.
What questions should anyone ask if they see something like that?
Well, gosh, where do I start? First of all, you want to try to find out as much about the hypnotherapist or the hypnotist as you possibly can, and unfortunately, sometimes that's very difficult to do. The second thing is ask about this great guarantee. What is it really? And the magic number with many of the traveling hypnotists, at least that we have come in contact with, so the magic number is 100. Well, you've got a group of people, about 23% of the world's population, that are called somnambulists. They go in and out of hypnosis very, very quickly every day. Well, that's who most of the traveling hypnotists are going for. And so the result is, I'll give you a guarantee you can come back to my session, which is 300 to 500 miles away, if this doesn't work. But in your town, you look, there's 23 of your friends and neighbors that you know very, very well, and they stop. So what's wrong with me? The answer is nothing wrong with me. They just happen to have a profile of a person who takes suggestions very, very well, and the hypnotist or hypnotherapist wasn't giving them what they needed so that those suggestions would stick.
You know, with group hypnosis, I want to ask you a question.
Sure.
I do group hypnosis, but everybody knows that I teach a mommy and me called Using Self-Hypnosis to Be the Parent You've Always Wanted to Be. Are you against any kind of hypnosis for a group?
No, absolutely not. Now, here's the big difference. Where I have trouble with group hypnosis is when we load up a whole room in a hotel room, and we're going to go after something that's kind of, you know, like overeating, smoking, or even something else like ADD, ADHD, or autism. In the particular case that you cited, you're teaching them self-hypnosis, so you're teaching them a procedure that they're going to use on themselves. If you happen to be a person that is what HMI refers to as more of the emotional type, it's a person who's logical, rational, reasonable, likes to be in control, then you're going to take inferred suggestions. You're teaching your clients in the Mommy and Me course how to use those inferred suggestions so that they'll accept it themselves. After all, they're taking the suggestion from themselves, so the subconscious is more apt to take it. But anything else, I will always say, if I could, I would rather have a one-on-one session.
Excellent. You know, here at HMI College of Hypnotherapy, we talk about practicing in scope, vocational, avocational self-improvement. I've seen hypnotherapists who are neither psychologists nor MDs, who are practicing out of scope. How do we want to make sure that the hypnotherapists we're using are only practicing what they have been trained to practice?
That's a fantastic question. And what you have to do as the consumer, as the person going in, is you need to be very specific about what we refer to as a referring issue. Why are you coming here to see me? One of the things that is standard in my practice is I always have a consent form where I can speak to their physician. A physician here in the United States averages 15 minutes per time that you go in and see them. That's only enough time for them to identify symptoms. I'm with that client for a full hour. I become the adjunct to the physician. I become their eyes and ears, and with me communicating, oftentimes I give them information that they never knew, and they could be treating that patient for 20 years, and that happens. The other thing that is really important, especially from a clinician's side, is to simply realize that this doctor is going to start referring you his patients or her patients because they are getting quality care from you and you're keeping the lines of communication open.
You know, I talk to a lot of hypnotherapists here, and many of them do some of their advertising when you talk to them on the phone or in person by saying, well, I have another client who smokes. I have another client who has pain. I have another client who bites nails, and let me tell you what happened with that client. Why is that unethical?
Wow. Well, first of all, in my opinion, you're violating the confidentiality goes, and it also violates my personal ethics. If someone asks me, and I do get the call quite often, well, how successful is hypnoanesthesia for pain? I tell them, in my experience, it's been very successful, and that makes about 35% of my client base. I'm not violating anyone's confidentiality. I'm not giving any specifics about anything. I'm just giving pure facts.
You know, this is very helpful, this book, for someone who's trying to choose a hypnotherapist.
Right.
But when I read it, as a hypnotherapist, I found it very, very helpful. How can hypnotherapists, how can clinicians use this book to help with his or her practice?
A lot of different ways, and that was the second way that I wrote this book specifically for the clinician, because you're basically briefing yourself on what is the client really asking you for and the way to approach it so that they're getting the information that they really need. One of the problems that I experience so much is people don't know that much about hypnosis or hypnotherapy. They have a lot of false ideas, innuendo, or stuff that some authority figure in their life told them. So this will give you the answers. For example, one of the questions that I tell all the clients to ask is, could you please define what the job of a hypnotist or hypnotherapist is? Well, the Federal Dictionary of Occupational Titles is very specific. It tells us exactly what it is. But if you're talking to a hypnotist or hypnotherapist and they don't know, and they can't tell you what an emotional or physical suggestible is and why, there's something wrong, because the federal government says that's what we're supposed to do.
You know, you flew in from Missouri to come, and this is the first stop on your book tour, and I'm very, very honored. Many times I call you to help me mentor when I'm stuck with a client on a certain idea. Can you please tell me a little bit about your hypnotherapy center?
Sure. First of all, our business model is quite different than most. We work on the spirit of cooperation, not on competition. In other words, you could never have too many hypnotists or hypnotherapists in the world, period. That's a blanket statement of mine. The other thing is that we respect everyone's confidentiality and privacy, and I'm not afraid to sit down there and say, you know, I want to have a medical referral. Even if it's something that I don't think I need a medical referral, as goes to the old cliche, when in doubt, refer out, I always do. The response to that is really amazing. Most of the referrals I get are from MDs, DOs, and psychologists that have said, my patient is here, I've worked with them for so long, and I can't get them beyond that. So for example, I had a person that was referred to me that had been in therapy for 2 years that had trouble getting into elevators, and they had to get into elevators because of their job. It took 3 sessions of hypnotherapy to resolve that issue. That is something very positive, and that's what we're all about.
And you're very well respected in Missouri, which had a lot of skepticism as you opened up your center.
It was one of those things that I had been accused of, as much as I hate to say it. Is this witchcraft, devil's work, or anything else? The religious community was not overly warm and welcoming to me. But over the years, I've shown them where, really, in my opinion, that the subconscious is really God's gift to us, whatever we call God. It is the way for us to heal ourselves, and all I am is I'm a conduit. I teach you how to do it. I'm not doing anything. I'm teaching you how to do it. And the doctors refer on that.
What would be the number one thing you would tell anybody who's interviewing a hypnotherapist? Give us your best.
Wow, that's so open, but the first thing I would say is I want to see personal liability insurance, and I want to know ethics. I want to know that the person is very, very ethical, and how much they practice. That's important.
What about money? What if someone is pressuring you for money?
Well, that falls under the ethics side. In my practice at the center, what we do is you'll come in for a clinical intake. Everyone starts off that way. That gives them the chance to interview me, and me the chance to interview them to see if I can really do some good for them. And I always tell them that past paying for the clinical intake, this is a plan of treatment I'm proposing. This is about what I expect you to budget for. I don't want your money right now. I want you to go away, think about it for a couple of days, and then if you decide to do it, call me and we'll talk.
David, I couldn't agree more, and I think that if anyone feels pressured by a hypnotherapist, that is your trigger to hang up the phone and call elsewhere.
Yeah, run.
Now, I know you're in Missouri, I'm in LA,
yeah.
But do you Skype? Do you have phone sessions? How can people all over the world come and take advantage of these wonderful services?
I've got a worldwide clientele. I do a lot with FaceTime. I do a lot with Skype, and I do telephone sessions as well. And it's amazing. I've had the opportunity to work with so many people that I've never met. And while I'm here in LA, I did call some of them and say, would you please come down because I'd like to meet you. And the other thing is, always keep in mind to build up a referral of hypnotists and hypnotherapists so that if you get stuck, and we all do, you've got someone else that you can go to and say, this is my problem, this is where I'm at, could you give me another viewpoint on it? That's very important.
Well, I know everybody's going to want a copy of your book, How to Find, Interview, and Select the Perfect Hypnotherapist. Where can we get it?
Amazon, Kindle, and hopefully near all the bookstores here pretty soon.
I love it. Well, you know what? Everyone's going to want to find out more about how to interview the perfect hypnotherapist and about your unique hypnotherapy style. Mm-hmm. And you can reach Dr. David Newman on hmigrads.com. Looks like we need to take a short break, but please stay tuned because when we come back, we're going to meet another hypnotherapist and author. I would like to thank my guest, Dr. David Newman, for coming on and talking to us about his book and about his very ethical philosophy on hypnotherapy. Stay tuned. We'll be right back right after the break.